There are a number of health concerns that we need to take into consideration. For people who have diabetes or other medical conditions that require them to take medication during the day, this is something that needs to be discussed with their doctor or primary care provider to see if there are ways that medications can be adjusted, that timing of medication can be adjusted, and to also be aware of which medications might put them at greater risk for low blood sugar or high blood sugar. Staying hydrated during Ramadan is key, and that can be a challenge during the longer, hotter summer months. But what I recommend for everyone is that during the hours where you can eat and drink, and that is after you break fast, after sunset, and before you start fasting at dawn, you try to hydrate as much as possible. I actually found that a very practical way to do this is to break my fast by drinking 2 full cups of water and then trying to drink at prayers and between prayers during the night, and making sure that I'm hydrating well in the morning as well. For people who are used to an exercise regimen during Ramadan, I think it's reasonable to do a couple of trial days of exercise while you're fasting to see how things are going for you. There's a good rule of thumb that if you usually exercise at X amount when you're not fasting, maybe decrease the intensity or the duration to about half of that during Ramadan to make sure that you're not pushing yourself too hard and that you're not getting dehydrated or using up your energy stores too quickly. So for people with diabetes, sometimes fasting can be beneficial. For people who have type 2 diabetes and for whom their diabetes is well controlled, fasting can actually be an opportunity to make sure that you're eating healthy, eating the right kinds of foods to help regulate blood sugar. We do know from research that even intermittent fasting can be beneficial to people who are fasting for reasons outside Ramadan.